Now I am going to talk about complications of type 1 and type 2 diabetes. The complications can be grossly differentiated into either microvascular complications, which are affecting the small blood vessels in our body, or macrovascular complications, which are affecting the large vessels in our body. The microvascular complications are retinopathy. That is, the retina is the innermost layer of the eye. It is very much sensitive to the high blood sugar and high blood pressure. So retinopathy is one of the chronic complications of diabetes. The second microvascular complication of diabetes is nephropathy. That is, your kidney vessels are again prone to damage by the chronic high blood sugars. Nephropathy can be seen in patients who are suffering with diabetes for more than 10 years and who has retinopathy also. And another microvascular complication is your neuropathy. That is, the nerves, small nerves or large nerves in your body can be affected by the chronic high blood sugars. This retinopathy, nephropathy, neuropathy are the microvascular complications which we usually see in our diabetic patients. We want to screen them for these retinopathy and nephropathy, neuropathy at least once in a year. We have to check their fundus to see the changes in the retina. We have to check their creatinine levels. We have to check their urine for their protein loss, and we have to do the nerve studies like vibration perception threshold at each visit of the doctor or at least once annually. These are the various parameters to check for the screen for the microvascular complications. Now I am going to talk about macrovascular complications. The macrovascular complications are like heart disease, especially myocardial infarction, heart failure, or cerebrovascular diseases like stroke, transient ischemic attacks, or peripheral vascular diseases like gangrenous disorders, or it can be occlusion of any peripheral vessels. All these macrovascular complications and microvascular complications, quality of life of the diabetic patient. Hence, they need to be periodically screened for these complications. Along with this complication, there are various other complications like musculoskeletal complications. The musculoskeletal complications can be a frozen shoulder or trigger finger or various other complications that can be seen in type 2 diabetes. So, what are the measures you can take to prevent these complications to get developed? You have to keep your blood sugar under control. You have to keep your blood pressure under control. You have to keep your bad cholesterol under control to prevent these complications.